Do you know where the inside of your body ends and the outside begins?
Oh, that seems like a trick question, right? I mean, you look down at your skin, you think, well, obviously, that's the border. The skin is the wall.
Right. But when you actually dive into medicine and biology, defining that exact boundary is, well, it's everything. It is not as simple as just looking in a mirror.
No, it really isn't.
So in today's deep dive, we are going to explore 3 tiny ancient Greek prefixes: endo, exo, and ecto. And, on the surface, this might sound like we are about to sit through a grammar class, but what we're actually looking at is a map.
Yeah, a map of, like, the fundamental blueprint of life.
Exactly. It's how humans survive, how animals manage to grow to these massive sizes, and even how some of the most deadly toxins on the planet operate.
These 3 prefixes are essentially the navigational coordinates of life. They govern our entire understanding of the human body, but their influence stretches, way beyond that. We see them in early embryonic development in the engineering of modern robotic technology, all the way to life-or-death emergency room diagnoses.
So to start mapping this out for you, the listener, we need to define the trio. So endo means inside or situated within. Meanwhile, exo and ecto, they both translate to outside or external.
And right there, that is where we hit the biggest trap in medical terminology.
Trap.
Yeah, because exo and ecto both mean outside. A lot of people naturally assume they are just interchangeable, but they are absolutely not.
Right.
You will never, ever hear a biologist talk about an ectoskeleton. It is always an exoskeleton.
Yeah.
Conversely, a developing embryo forms an ectoderm, never an exoderm.
Which is just maddening if you were just trying to parse the language, right? I mean, if they both mean outside, it feels like I should be able to just swap them depending on how the sentence flows.
You would think so, yeah.
Yeah.
But convention completely overrides logic here.
Yeah.
You cannot derive this from, like, first principles or grammar rules. These pairings were locked in, root by root, as they entered our scientific vocabulary over the centuries.
How interesting.
Yeah. So historically, endo and ecto were usually coined together as a matched set, describing static physical layers, like an inside layer versus an outside layer. Exo, on the other hand, tends to pair with endo when we are talking about a dynamic process or direction, like an internal origin versus an external origin.
It reminds me of learning irregular verbs in a new language. You can't just logic your way through it. You just have to know the history of how the word was born and accept it.
Exactly.
But that makes me wonder, who actually locked these words into our dictionaries this way? Because if it wasn't a linguist, who was assigning these terms?
So to find the culprits, we actually have to travel back to the 19th century. Specifically, this period between 1817 and the 1870s, which was the dawn of a field called germ layer embryology.
Okay, I'm guessing this has nothing to do with germs as in, like, bacteria?
Good catch. No. In this context, germ just means to germinate or grow. So in 1817, a Baltic German embryologist named Christian Pander was obsessively studying chick embryos.
As one does.
Right. And he was the first to realize that an embryo doesn't just grow as a single uniform blob. It develops from 3 distinct, separate layers of tissue that fold and interact.
Oh, wow.
Yeah. And then a few years later, in 1828, another scientist named Carl Ernst von Baer proved this wasn't just true for chickens. It was the fundamental rule across all vertebrate embryos.
So they basically discovered the layered architecture of life. But did they give those layers the names we use today?
They didn't, actually. The terminology came decades later, in the 1870s, from a German biologist named Ernst Haeckel.
Okay.
Haeckel popularized the terms ectoderm for the outer layer, mesoderm for the middle layer, and endoderm for the inner layer. And those terms became the permanent functional anatomy we still learn today.
Okay, let me see if I can map those really quickly. The ectoderm, so the outer layer, that eventually becomes your skin and your nervous system, right? And then the mesoderm in the middle becomes your muscle, bone, and blood. And the endoderm, the inner layer, becomes the lining of your gut and related internal organs.
Spot on. But the funny thing is, Haeckel didn't just coin these terms to be helpful to future anatomy students. He had this massive, hidden agenda.
Wait, really?
Yeah, he created this vocabulary to support a grand, overarching theory of animal evolution he called the Gastraea theory.
Gastraea theory.
Haeckel basically believed that every single multicellular animal on Earth descended from one specific hypothetical 2-layered ancestor that he imagined looked like a tiny cup.
I mean, it sounds incredibly elegant, but knowing 19th century science, I feel like there's a catch here.
Oh, there was a huge catch.
Yeah.
The Gastraea theory was completely wrong.
Oh.
Modern science has totally discredited it. Evolution didn't happen the way Haeckel envisioned it all. But his vocabulary was so useful for describing the physical reality of the embryo that it just stuck.
That is such a fascinating historical irony. I mean, scientific vocabulary can outlive the faulty theories that birthed it.
Yeah.
We are literally still using the words of a debunked evolutionary theory to accurately describe modern human biology.
It's a strange quirk of history, for sure. And right around that same time, just a few years later in the late 1800s, this same prefix logic was locked into a totally different field, microbiology.
Okay.
But this time, it wasn't about how life grows, it was about how life is destroyed.
Oh, you were talking about toxins.
Specifically bacterial toxins.
Yeah.
So in 1888, two French scientists, Émile Roux and Alexandre Yersin, were studying the bacterium that causes diphtheria, which was just a horrifying and lethal disease at the time.
Right.
And they made a terrifying discovery. The bacterium wasn't just existing in the body, it was actively manufacturing a soluble poison and exporting it outward into the victim's tissue.
Oh, wow.
Because the poison was being pushed out of the cell, they called it an exotoxin.
So the exo here implies the outward movement. The bacteria is basically building a weapon and throwing it over the castle wall.
Precisely. But then the scientific world got a huge shock 4 years later in 1892. A German bacteriologist named Richard Pfeiffer was studying cholera. He was trying to find the exotoxin for cholera, but he just couldn't.
Because it didn't have one.
Right. Instead, he realized cholera was doing something completely different. It wasn't secreting a poison at all. The poison was a physical part of the bacterium's own cell wall. It was locked inside the structure of the organism.
Wait, so how does it hurt you if it's locked inside?
It only releases the poison when the bacterium is killed and breaks apart. So Pfeiffer coined the term endotoxin for this.
Oh, it's a biological dead man's switch. You attack the bacteria, you kill it, and by killing it, you trigger the release of the poison into your own system.
That is the perfect analogy. And it is one of the cleanest, most literal applications of the endo and exo opposition in all of medicine. An exotoxin is a weapon intentionally fired outward by a living organism. An endotoxin is a structural component kept inside, only unleashed by the organism's death.
So if we take that history, from the physical layers of an embryo to the movement of bacterial poisons, the underlying logic really starts to come into focus.
Wow.
You pick a boundary, whether it's a cell wall or an organ, and you ask, is this thing staying inside the boundary or is it crossing to the outside?
Exactly.
Which brings us to the secretion pathways in our own bodies, right? The endocrine system versus the exocrine system.
Yes, this is a brilliant example of how these prefixes explain the mechanics of how our bodies actually communicate. Every gland in your body essentially does one of two things. An endocrine gland dumps its product directly into the bloodstream. It does not use a duct or a tube.
Okay, so I'm thinking about things like the thyroid or the adrenal glands. They produce hormones, and those hormones seep straight into the circulating blood. So the outside of the gland is still deeply internal to the body's closed loop.
Right. The bloodstream acts as a massive internal superhighway, delivering that signal everywhere. But an exocrine gland operates on a completely different mechanical principle. It sends its product out through a specific duct to reach a surface. Think of your sweat glands or your salivary glands. They manufacture a product and physically push it through a tube out to the skin or into the mouth.
Okay, I have to stop you there and push back on this definition of outside. Because if a sweat gland uses a duct to push sweat onto my skin, I totally agree that is obviously outside. But what about a gland that uses a duct to reach my stomach or my intestines? Is the inside of my gut technically considered the outside of my body?
Topologically speaking, yes, it absolutely is.
You're going to have to explain that because my stomach feels very much like it's inside of me.
I know, it is entirely counterintuitive. But think of the human body like a donut.
A donut, okay.
A donut has a hole running right through the middle of it. The digestive tract is essentially a long, continuous tube running from the mouth to the anus. Because it is open to the external environment at both ends, the hollow space inside your gut, what biologists call the lumen, is treated functionally as the outside world.
Oh, that's wild.
Yeah, so when you swallow a piece of food, it is not actually inside your body's tissues yet. It is just traveling through the hole in the donut.
So when an exocrine gland secretes enzymes into the gut, it is literally pushing its product across a boundary, ejecting it out of the body's internal fluid compartments and into that external tunnel.
Exactly. And understanding that mind-bending topology sets up the ultimate teaching tool for this entire concept, the human pancreas.
The pancreas.
Yes, the pancreas is an incredible paradox because it is simultaneously an exocrine and an endocrine organ. It straddles the boundary.
Wait, how does one organ play both sides of the fence like that?
Well, about 98% of your pancreas is purely exocrine tissue. Its job is to manufacture harsh digestive enzymes and ship them down a duct into the small intestine, which, as we just established, is functionally an external surface.
Right, it's spraying chemicals into the donut hole to break down your food.
But then you have this tiny remaining fraction, just 1 to 2% of the organ, scattered throughout the tissue. These are clusters of cells called the islets of Langerhans, and they are pure endocrine tissue.
And what do?
They make insulin and glucagon and secrete them directly into the blood to regulate your blood sugar.
That is fascinating.
And we understand this dual nature thanks to a landmark and honestly quite elegant experiment in 1902 by two English physiologists, William Bayliss and Ernest Starling.
What did they do?
They wanted to know how the pancreas knew when to release its digestive juices. At the time, everyone assumed it was controlled entirely by the nervous system. The brain sends a spark, the pancreas secretes.
So how did they prove it wasn't just nerves?
They operated on an anesthetized dog. They completely severed all the nerves connecting to the pancreas, isolating it from the brain, but they left the blood vessels intact.
Okay.
Then they injected a bit of acid into the dog's small intestine to simulate food arriving from the stomach. Even with all the nerves cut, the pancreas immediately began secreting digestive juices.
Because the signal didn't travel through the wires of the nervous system, it traveled through the plumbing of the bloodstream.
Precisely. They proved that the gut released a chemical into the blood, which traveled back to the pancreas and triggered the response. It was direct, undeniable evidence of endocrine signaling. They actually coined the word hormones a few years later to describe these chemical messengers.
Wow. So we see this strict boundary keeping us alive at a cellular and glandular level. But if we take that idea, the strict boundary of inside versus outside, and apply it to physical architecture, it actually dictates the maximum size a living creature can reach. I want to look at skeletons really quickly. Vertebrates, like you and me, have an endoskeleton. We have hard bones locked deep inside with our soft tissues wrapped around them.
Right. Whereas arthropods, so insects, spiders, crustaceans, they have an exoskeleton. They wear their armor on the outside. It's a hardened outer shell, usually made of a tough material called chitin, with all their soft muscles and organs tucked inside it.
And this structural difference isn't just like trivia for a biology quiz. It dictates the very limits of how life scales up on planet Earth.
Absolutely, because having an exoskeleton comes with a massive compounding metabolic cost. Think about how an insect grows. Because its skeleton is a rigid external box, it cannot grow continuously.
Right.
It has to shed its skeleton through a process called molting, swell its soft body up with air or water, and then expend massive amounts of energy secreting and hardening a brand new, larger shell.
And during that molting window, it is incredibly vulnerable to predators because it's essentially a soft, defenseless protein snack.
Exactly. Plus, as the animal gets larger, an exoskeleton has to become exponentially thicker and heavier to support the body's weight. Eventually, the insect wouldn't even have the muscle strength to move its own armor.
Oh, that makes sense.
That physical and energy constraint is a major reason why bugs are small. You cannot have a spider the size of a minivan because physics and metabolism just won't allow it.
Which I am personally very thankful for. But an endoskeleton flips the script. Because our bones grow with us, from the inside out, they are incredibly lightweight and efficient. It allows life to scale up to massive proportions, like elephants or blue whales.
Yeah.
And what is amazing is that human engineering is now taking that ancient Greek root and literalizing it. We are building external skeletons to assist our internal ones. Wearable robotic exoskeletons are being used in physical therapy, for stroke patients, or people with spinal cord injuries.
It's a beautiful extension of the terminology, taking a biological concept that limits the size of a beetle and engineering it to restore mobility to a human. And the stakes of knowing inside versus outside become even clearer and honestly far more urgent when we look at how life feeds on other life.
Now the world of parasites.
Yes. Parasitologists divide their entire field exactly along these boundary lines. You have ectoparasites. These are your ticks, your lice, fleas, scabies. They live and feed strictly on the host's surface. And then you have endoparasites, tapeworms, roundworms, or the plasmodium parasite that causes malaria. They bypass the skin entirely and live deep inside the tissues, the gut, or the blood.
And the reason this distinction is so crucial is how it dictates treatment, right?
Well,
If you have an ectoparasite, like head lice, you treat it by attacking the surface. You use a medicated shampoo or a topical cream. The medicine never needs to enter your bloodstream.
Right.
But if you have an endoparasite like malaria, rubbing a cream on your arm won't do a thing. You have to use systemic bloodstream drugs to hunt the parasite deep inside your own tissues.
And that neat division works perfectly.
Yeah.
But what's fascinating is what happens when we try to force nature into these clean, binary categories, and nature refuses.
Yeah.
Because biology is incredibly messy.
Yeah.
When scientists push the inside-outside binary too far, trying to categorize everything as purely internal or purely external, the system breaks down.
We have definitely seen this happen spectacularly in the history of science. Let's look at the famous failures, starting with psychiatry.
Right, so for a large part of the 20th century, the psychiatric establishment desperately wanted a clean algorithm for treating depression. So they tried to split it into two neat, mutually exclusive categories.
Okay, what were they?
Endogenous depression was thought to arise entirely from internal, biological, or genetic causes. The patient's brain chemistry just changed with no obvious external trigger.
And the other bucket was exogenous depression, sometimes called reactive depression. This was viewed as a direct response to a specific external event, a job loss, a divorce, the death of a loved one.
The psychological appeal of this split was huge. It offered a roadmap. The theory was that if a patient had endogenous depression,
Right.
an internal hardware problem, they would get somatic treatments, like heavy medication or electroconvulsive therapy.
Right.
But if they had exogenous depression, a software issue triggered by life, they would get talk therapy.
But the human brain does not respect neat little boxes like that. The binary completely fell apart.
It failed on every level. Decades of clinical research failed to show any clean separation. They found that patients with clear, devastating external triggers often showed profound internal biological markers, like altered cortisol levels or sleep architecture disruptions. The external stress literally changed their internal biology.
And conversely, patients with no obvious external trigger often responded wonderfully to cognitive behavioral therapy, rewiring their own brains through conversation.
Precisely. By 1980, when the third edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM-3, was published, psychiatry officially threw in the towel. They scrapped the endogenous and exogenous diagnostic split entirely. It turned out it didn't carve reality at its joints. The vast majority of depression involves both internal vulnerabilities and external stressors colliding at the exact same time.
We tried to make a binary where there was a spectrum, and we saw the exact same illusion shatter in paleontology with one of the greatest scientific arguments of the 20th century, the dinosaur debate.
Ah, the dinosaur renaissance. This is a classic example of challenging the inside-outside dogma.
Right. So traditionally, we classify reptiles as ectoforms. They rely entirely on external heat basking in the sun or resting on a warm rock to regulate their body temperature. They're what we casually call cold-blooded. Right. And for over a century, the scientific consensus just assumed dinosaurs were giant, sluggish ectotherms, dragging their massive tails through swamps, just waiting for the sun to warm them up.
Until the late 1960s, when two paleontologists, John Ostrom and his student Robert Baker, sparked a fierce and highly controversial debate. They looked at the fossil record and realized the evidence didn't point to sluggish lizards at all.
What did they see?
They argued that many dinosaurs, especially the agile bipedal predators, were actually endotherms. They were generating their own internal heat, just like modern birds and mammals.
Now wait, how do you prove the internal body temperature of an animal that has been dead for 65 million years?
They used a few brilliant lines of evidence. First, they looked at bone histology. When you slice open the bone of a modern mammal, it is packed with dense vascular channels called haversian canals, which show rapid continuous growth fueled by a high metabolism. Ostrom and Baker found those exact same dense vascular patterns in dinosaur bones.
And they also looked at the predator-prey ratios. Right. This is my favorite piece of evidence.
It is incredibly clever. Endotherms, warm-blooded animals, have to burn a massive amount of calories just to maintain their internal furnace. An ectotherm doesn't.
Okay.
This means a warm-blooded lion needs to eat significantly more meat than a cold-blooded crocodile of the exact same size. So in a given ecosystem, you need a massive population of prey to support just one endothermic predator. When Baker looked at the fossil record, he found exactly that. A very small number of dinosaur predators compared to a vast sea of herbivore prey. The ratios perfectly matched modern endothermic ecosystems.
But I want to pause here and clarify a massive misconception. Because when people hear cold-blooded versus warm-blooded, they tend to project a hierarchy. They assume an ectotherm is primitive or inferior to an endotherm.
Yeah, that is a very human bias. Being an ectotherm is not less advanced at all. It is a brilliant, highly successful evolutionary strategy for energy efficiency. Ectotherms need a fraction of the food that endotherms do because they aren't burning calories just to stay warm.
Oh, right.
That is why a snake can eat a single large meal and go weeks or even months without eating again. If a mammal of the same size tried that, it would starve to death in days. It was a metabolic trade-off, not an evolutionary ladder.
So we had this massive debate where dinosaurs ectotherms or endotherms. We tried to categorize their metabolisms like a simple light switch, either strictly on generating heat inside or strictly off requiring heat from the outside. But nature, again, prefers a dimmer switch.
That dimmer switch analogy is exactly where modern science landed. Today, backed by advanced isotope analysis of fossil teeth, the consensus is much messier. Many dinosaurs were likely mesothermic, somewhere in the middle of the dial.
Mesothermic.
Yeah, they generated some internal heat through muscle movement and digestion, but they didn't defend a strict high-running baseline temperature like a modern mammal. They blurred the boundary. And of course, the theropod dinosaurs that survived, the ones we call birds, eventually evolved to be fully endothermic.
So we've covered embryology, psychiatric history, and dinosaur metabolisms. But if you are listening to this, you might be wondering how this actually applies to you today. Because knowing these prefixes isn't just trivia to win at Jeopardy! If you ever have to interact with the healthcare system, this is the literal language of the emergency room.
It absolutely is. Understanding these roots can demystify terrifying situations. Take the word ectopic. It combines ecto with topia, which means place. It literally translates to out of place or located on the outside of where it should be.
And in a clinical setting, an ectopic pregnancy is when a fertilized egg implants outside the main cavity of the uterus, usually getting stuck in a fallopian tube. That is not just an unusual pregnancy. Because the tube cannot expand like the uterus, it is an instant, life-threatening surgical emergency. If you hear that word, you immediately know the structural reality of what is happening.
And remember Richard Pfeiffer's endotoxins from 1892, the poison locked inside the bacteria cell wall.
Yeah, the dead man's switch.
Exactly. That 19th century discovery drives frontline decisions in intensive care units every single day.
How does that play out in a modern hospital?
There is a classification of bacteria called gram-negative bacteria, which just refers to how they react to a specific laboratory stain. But what makes them dangerous is their outer membrane, which is packed with lipids and sugars. That lipid layer is the endotoxin.
Oh.
When a patient has a severe infection and gets treated with antibiotics, millions of these bacteria die and burst open simultaneously.
Triggering the dead man's switch all at once.
Exactly. The endotoxins flood into the bloodstream all at once. The human immune system detects this massive debris field and absolutely panics, launching a hyper-aggressive inflammatory response. That overreaction causes blood pressure to plummet and organs to fail. It is a condition called septic shock, and it remains one of the leading causes of death in hospitalized patients worldwide. The battle to manage endotoxins is a daily reality for ICU doctors.
Wow. But even outside of dire emergencies, this language is everywhere once you know to look for it. If you go in for a routine procedure to examine the lining of your stomach or your colon, it is called an endoscopy or a colonoscopy. It combines endo with loscopy, which means to view or observe. Literally, an instrument to view the inside.
Once you grasp the logic, medical terminology stops looking like a wall of random Latin and Greek and starts looking like functional architecture.
And that is the ultimate takeaway here. For you, the listener, by understanding just a few syllables, you suddenly gain a lens to decode your own medical charts. When a doctor talks about an endocrine issue, you instantly know they are talking about internal signaling through the blood, not a localized duct. You understand the structural logic of the human body.
It really transforms confusion into clarity. We've journeyed from 19th century biologists squinting at chicken embryos to the mechanics of cholera toxins to the fierce debates over dinosaur bones, all the way up to wearable robotics. And all of it is governed by three little prefixes: endo, exo, and ecto. They force us to constantly ask the most fundamental question in biology: where do we end and where does the rest of the universe begin?
Which leaves me with one final thought to mull over, building on what we discussed about bacterial endotoxins and malaria parasites. Because an endotoxin stays locked inside a single bacterial cell, and a malaria endoparasite hides inside a single human red blood cell. When you really zoom in, the true boundary of inside versus outside isn't our skin at all. We are actually made up of trillions of microscopic, individual boundaries, each with its own internal and external world, communicating across incredibly fragile membranes. When we say inside the body, we're really just talking about a massive walking ecosystem of tiny walls. Thank you for joining us on this deep dive. Stay curious and try looking a little differently at the hidden boundaries of the world around you.